We will be exploring psychosocial support, social emotional learning, and protection services during the pandemic. My name is Kate Lapham, and I am the lead for USAID's Education in Crisis and Conflict Network, ECCN, and one of your facilitators today. My co-facilitator will introduce themselves in a moment. We are recording today's webinar so that anyone who is unable to attend will be able to view it later. We have a range of ECCN members participating in today's webinar, including education, psychosocial support, social emotional learning, and protection practitioners, as well as USAID staff from around the globe. It is wonderful to see such enthusiastic and diverse participation. So today's webinar allows us to pause and reflect together on our ongoing COVID-19 recovery efforts. This webinar is the first in a USAID Leading Through Learning Global Platform series, highlighting promising education practices from across the world and the ways that they are making an impact. This webinar also serves as a developmental learning opportunity for us all, as during the next hour and a half, we will engage in joint reflection, sharing, and learning about resilience through the COVID-19 response and recovery, as well as what we can take forward in ongoing recovery efforts. So I welcome and I encourage you all to enjoy and engage during this event. There are opportunities throughout the webinar for you to share your insights, including a small group session for discussion and learning. Please also note the norms for today's webinar so that we can all participate happily. First, we are really pleased to offer interpretation in Spanish and French. You can listen in one of these languages, by selecting either the Spanish or the French channel from the interpretation icon at the bottom of your screen. Please mute the original audio when you enter the translation channel so that you can hear more clearly. Please also ensure that your name in the participant list matches the one that you use to register so that we can move you into the breakout room of your preferred language. When you are not speaking, please mute your microphone and turn off your camera. You can use the chat box to post questions or comments throughout. Any questions for the presenters provided in the chat box will be collected, and we will share responses after the event. And finally, if you have any technical issues, please send our producer a private message. You can find her under the handle USAID ECCN. So now I would like to introduce my co-facilitator for today's event, Julie Chinnery from University of Auckland, to give us a bit more context on the research behind today's webinar. Because of bandwidth issues, her colleague Ritesh Shah may step in to support her. Over to you, Julie and Ritesh.
Thanks, Kate. I'll start talking and let's see how the bandwidth holds. And Ritesh, please jump in if needed. So as Kate said, my name is Julie Chinnery with the University of Auckland. I'm in a research team who's currently looking into doing some research into education and COVID-19 broadly, and looking specifically at effective tools and effective approaches that have been implemented during the COVID response to date. So looking at the bigger picture of COVID, we know we've all been really busy for the past 2.5 years responding to the demands of the pandemic and striving to meet the needs of the populations most disproportionately affected by the pandemic. And we know that COVID has actually re-emphasized for the globe the vital role that education does play in emergencies, which we all know, but a nice reminder for the globe, and especially the important role that psychosocial support services, social and emotional learning services, and protection services play in helping learners to not only be retained in learning, but actually engaged in learning during crises. So, and especially in a crisis like this, where children were socially isolated, they were at home, they were stressed by the pandemic. So today's webinar then, as Kate was saying, is really an opportunity for us to have a look at what have been some good PSS, cell and protection practices which have been working towards sustaining learning outcomes during COVID, because we know that the links between learning outcomes and these types of but that have insight into today help to make it clear for us how.
Julie, I'm going to step in just because I know that your bandwidth is kind of eluding you, and I'll pick up where Julie left off. So what we're going to do today is really look at what can we learn from the interventions, keeping in mind that really the common thread across them is they're all examples of ways that from different entry points they've worked to sustain learning outcomes, and why and how and to what end they can kind of inform our ongoing recovery efforts. So today there are 3 diverse presentations which are from across the world, which highlight these different promising practices. These are not the only interventions that have incorporated promising practices. We identified them through a response to a survey that we put out through ECCN, calling for implementers who were willing to share promising practices during COVID. Thanks to many of you, some of you who may be on this call, who responded to offering to share your work. We were actually overwhelmed by the amount of good practice and lessons learned that people were willing to share with the wider sector. So in the end, the 3 interventions that were identified were selected because for 3 reasons. The first is that they were informed by evidence and have generated evidence to demonstrate the outcomes of their efforts. In other words, how they are helping learners to stay connected to learning during COVID-19. The second is that these are examples of interventions that have been able to strategically identify and leverage opportunities within their context on to kind of build a response that goes beyond immediate response and moving towards recovery. And then lastly, they were identified because they're quite diverse in terms of where they work, different stakeholders using different mechanisms to respond. And then by doing so, highlighting the kind of range of different types of COVID responses within this wide topic area. We chose this selection criteria, particularly the first 2 that I mentioned, as these are really key components, amongst others, about how we can start to think about the concept of resilience specifically. And this is of particular interest to USAID as it continues to develop guidance and policy on education and crisis response, and specifically regarding resilience in education. For those of you who haven't yet seen it, right before the onset of COVID, USAID released a white paper on resilience in education, which, of course, when COVID hit, presented them and all of us an opportunity to investigate how wider society resilience can manifest through education in response to crisis. And you can download this white paper by scanning the QR code on this slide or clicking on the link in the chat box. During COVID-19 then, USAID commissioned a series of investigations into resilience in education during COVID. One of them was a piece we worked on as a precursor to this current research, the Return to Learning case studies, which dives deeply into 5 contexts around the globe and how education systems were able to, or not, identify and leverage different opportunities within their context or resilience capacities, as we use in the white paper and the Return to Learning study, and to what effect. This resource is also available for download from the chat box link or by clicking on the QR code. While we're now listening to the presentations today, and when we're in our breakout groups, what we'd like everyone to be listening for is how these interventions have, firstly, identified and leveraged opportunities within their context. Secondly, drawn on existing evidence and generated new evidence through their interventions. And thirdly, build foundations during the emergency response to support recovery programming. I'm now going to hand back over to Kate, who has a question for all of you to think about while we're listening to these presentations, and which will subsequently help the way we work in the small groups following them, these presentations. She'll then introduce the first of the three presenters today.
Thanks so much, Ritesh. So before we hear from our presenters, I would first like to hear from our participants on why psychosocial support, social emotional learning, and protection interventions have been so important throughout our education responses to COVID-19. Please drop your ideas in the chat box so that we can see your thoughts. And we'll give you a couple of minutes to do that. So I can see in the introductions that promising practices in these fields allow for better continuity, which is definitely true. Don't be shy, please drop your ideas into the chat. Absolutely, access to mental health and education supports support children who have been disrupted in their education. Well-being as a fundamental precursor to anything else we might want to achieve in learning and development, absolutely. Okay, so I encourage you to keep dropping your thoughts into the chat. And once you have posted your response, you can certainly scroll through and have a read of other people's thoughts. There are some great ideas here around mental health and well-being, around the stress that families have experienced during the pandemic. The relationship between trauma and being able to learn to achieve learning outcomes. It is really great to see these responses, and we can see some clear themes emerging here already. Thank you so much for those. We will return to some of the ideas captured here a little bit later. So if you keep posting, they will not be lost. Yeah. Okay, then. For now, let's keep these topics in mind, as Julie and Ritesh had encouraged us to consider as we listen to our three presentations. Unfortunately, we will not have time to take audience questions for our presenters today, but please do post any questions that you have for them in the chat box. We are collecting them, and we will ask the presenters to respond to them in a document that we can distribute in a follow-up message to everyone who has registered. Our first presentation today is from George Odwe from Population Council Kenya, who will be sharing with us an intervention that provided technical support to the Ministry of Education in Kenya to deliver a protection response for out-of-school girls. George, over to you.
Thank you very much, Kate. Good morning, good afternoon, everyone. As Kate has mentioned, my name is George Odwe, a research associate with Population Council based in Kenya. I'm delighted to share with you today the lessons learned from 40's initiative, which aim at getting girls back to school. So let me start by just sharing a bit of the context. The COVID-19 pandemic disrupted education globally, and in Kenya, basic education and training institutions were closed for 9 months. As a result, education of about 15 million children in primary school and secondary schools were disrupted. So moreover, the pandemic disrupted girls' access to safe spaces and essential reproductive health services. We also noted that COVID-19 exacerbated the existing problems. There were some spikes in the early pregnancy, child marriages, gender-based violence, as well as transactional sex. So these challenges, compounded by acute household poverty levels, really hindered many girls' access or ability to return to school. So in terms of the intervention, Population Council has collaborated with the Minister of Education to expand access to secondary education for pregnant and parenting girls since 2014. Now, in 2019, Population Council collaborated with the Homa Bay County Department of Education to trace and track girls who are out of the schools. So this initiative was adopted by the Ministry of Education by adding the fourth T, which is basically as part of the education sector response to COVID-19. And this included a back to school campaign for girls. The 40s initiative is a Ministry of Education-led multi-sectoral intervention to operationalize the Kenya School Reentry Guideline for out-of-school children during the COVID-19 pandemic. The first T is TRACE, and TRACE stands for involving or working with teachers as well as head teachers to trace girls who did not return to school when the school reopened. The second T is track, which involves tracking out-of-school girls to their household with the support of the curriculum support officers as well as the local administration. The third T is involves talking to out-of-school girls and their families about education, as well as education and health policy, which supports return to school for pregnant or parenting girls. And the last T here is return to school, which basically involves supporting girls who are willing to go back to school so that they return to school. In addition to the track, Population Council provides technical support to the Ministry of Education to implement the 40s initiatives. The technical support here involves development of the tracking tools, the reentry guidelines, key messages, as well as monitoring tools. The technical support also involves sharing research evidence and evidence to inform policy and practice, and carrying out national sensitization through strategic partnership, for example, with the Kenya Secondary Education School Head Association, as well as the media to disseminate the learnings. So the 40s had three main outcomes at the government, community, as well as at the individual level. At the government level, the initiative was able to develop some indicators, and these school reentry indicators were adopted or integrated into the school reentry indicators for the National School Reentry Monitoring and Evaluation Plan. The government has also taken the ownership of this particular initiative, and this can be evidenced through the policy popularization, intervention monitoring, as well as the tracking the number of the girls who have entered to school. Now, at the community level, the 40s initiative intervention was effective in terms of improving awareness of, as well as the support of the school reentry policy and tools for the schools and at the community level. At the individual level, the 40 initiative enhanced education access for the marginalized girls. So the intervention was able to reach about 1,500 out-of-school girls and their family. Out of this, about a third were able to re-enter the school during the intervention period, and slightly more than a half were planning to re-enter school during the intervention period. The 40s initiative also enhanced education access for the boys. Although we did not really monitor the data, or we did not really collect the data on boys who had entered school, they were also the beneficiary because we spoke to the family members at the household level and encouraged both girls and boys to return to school. There are quite a number of enabling factors. One of the enabling factors is in terms of the favorable policy environment that we currently have in the country. So in Kenya, every child has a right to education, and this is enshrined in the Constitution, and it's also highlighted in the existing structures, policy structures. In terms of the implementation of the 40s program, it was implemented within the existing Ministry of Education structures. And the new school reentry guideline outlines a detailed framework for facilitating the school reentry of children who drop out of school for whatever reasons. Another important enabling factor here was the multi-sectoral partnership. So the Fortis was able to leverage existing strong partnership between Population Council Kenya as well as the Ministry of Education. And we really worked extensively with the Ministry of Education as well as the curriculum support officers who did the actual tracing and tracking of the out-of-school girls. We also worked with the local administration, especially under the Ministry of Interior and National Coordination. And Population Council here was the main partner in terms of providing technical support. However, there are quite a number of constraining factors. One of them is poverty. Although primary school is free in Kenya, but we find that families still incur some cost, such as buying the school uniform. And families in the rural areas tend to be large enough. And so you find that many of the girls are more subject to doing the household chores, limiting their participation in education. And childcare is also a major hindrance here. Another constraining factors was the harmful cultural practices, such as the early marriages and early pregnancies, which are kind of cultural norms in some communities. So after marriage, you find that young girls' access to formal education and even non-formal education is severely limited because of domestic burden. And in the 40s, we were able to see that only 20% of married girls were willing to return to school. Lastly, we find that the 40s was successful to address just an aspect of a problem, but there are still many, many challenges that are still left. For example, the pregnancy prevention is still a too sensitive issue to be addressed and really needs tangible solution. There's some adaptations and lessons learned from the 40s intervention. In terms of the Ministry of Education adaptations, they now have a set of tools for tracking and monitoring school reentry, which can be used in the subsequent emergencies and also in the day-to-day education administration. Population Council also is currently providing technical support to the Ministry of Education to develop the National School Reentry Implementation Framework, as well as the guidance and counseling policy, and both provides an opportunity for building evidence-based solutions, e.g. The parental engagement. In terms of the key lessons learned, one of the lessons we learned here was that the synergy between the Ministry of Education, the local administration, and the Population Council team really led to success in helping children re-entry to school. Engaging school head is also very important as they are the gatekeepers of the girls' school re-entry. Another lessons that we learned is that talking to parents as well as together with their children to really yield more positive result in the school reentry. And the last lessons that we learned here is that targeted messages for parents and girls is quite effective in terms of promoting school reentry for marginalized girls. Thank you very much, and that concludes my presentation. And then I hand it back to Kate. Thank you.
Thank you so much, George, for that really insightful presentation. So now we have a presentation from Danielle de la Fuente from Amal Alliance, who will share with us an intervention which worked with teachers, facilitators, and caregivers to deliver an EdTech social emotional learning response in Bangladesh and then in Greece. Danielle, over to you.
Good morning, afternoon, evening, everyone. I'm incredibly grateful for the opportunity to share our intervention. Let's journey back in time to March 2020, that moment when COVID changed life as we knew it. The pandemic undoubtedly disrupted education, placing additional toxic stressors on children, affecting their well-being, mental health, and creating greater learning barriers. This was especially true for marginalized communities, whose psychosocial and emotional well-being would be further affected. To this end, we spearheaded a COVID-19 emergency response consortium to deliver a collaborative podcast response distributed in April 2020 in 4 languages that reached approximately 160,000 users via WhatsApp. Our unique podcast instruction with tips for well-being caught much attention as one of the top ideas for crisis response, thus becoming the precursor to what is now known as Colors of Kindness. Colors of Kindness was born out of winning UNHCR's Humanitarian Education Accelerator COVID-19 Challenge. Our vision was to create an innovative EdTech solution that helps children grow in their social and emotional competencies that was inspired by our pre-existing Rainbow of Education curriculum. Designed to help cope with the effects of the pandemic, this holistic hybrid approach eases the transition back into the classroom while enhancing well-being. What makes this program truly unique is threefold. First, the audio instruction embedded within the digital workbook featuring our culturally sensitive genderless blobs allows anyone to facilitate lessons without needing a specialized degree. Second, it is delivered through a learning management system that works offline, enabling data collection with little or no connectivity. And third, programming supports not only the child's well-being, but also that of the teacher and caregiver. While we believe technology cannot replace classroom instruction, we leveraged it in a way that provided resources to underserved populations that couldn't log on to Zoom School as many locations did across the globe. This was our first time conducting monitoring and evaluation at distance, but we gathered quantitative and qualitative data through our weekly implementation log, emotions thermometer, as well as pre and post surveys from the parents, teachers, and the children. We initially piloted Colors of Kindness in September 2020 across 4 locations in Bangladesh, including Cox's Bazar, with children ages 6 to 12. It was a gender inclusive model with over 60% of the children and teachers being female. While no one knows what the long-term consequences of the pandemic will be in terms of student trauma, it is quite possible that the impact on students' mental health won't be apparent in the year they return. Displaced and disenfranchised communities were even further at risk from everything from early marriage to domestic abuse, human trafficking, and exacerbated toxic stress and trauma. This is why we chose to target our intervention towards displaced and disenfranchised children in the primary years and mitigate the aforementioned risks by empowering our youth. It also presented a unique opportunity for truly inclusive education, looking outside the realm of visual physical disabilities to address the invisible ones, which often present themselves as learning barriers stemming from anxiety or depression, for example. The results were phenomenal, showing a dramatic 16.5% increase of social and emotional competencies, with 99% of caregivers noting that their children's behavior and mood improved. One of the locations showed less promising results than others. Here, environmental factors such as impoverishment, malnutrition, and having been out of school prior to COVID played a big role, as children started from a lower point of well-being, which made incremental improvements much more challenging. COVID in and of itself was an enabling factor because the forced pivot from our Rainbow of Education to the Colors of Kindness modality became an easier model to implement. The nonverbal visuals and audio component allowed for a wider range of users, including those with limited skills or illiteracy. The pivot also forced us to identify and mobilize strategic partnerships to capitalize on collective capacity, whether it be through our local implementing partners, local technical expertise to inform programming and communications, or academic partners to strengthen our monitoring and evaluation. Establishing trust with the local community and our beneficiaries and implementing partners was key. Other key enabling factors were our human-centered approach that provided professional development in contexts where it was limited or non-existent. The adaptability of our content was easy to localize. And delivery via caregiver or facilitator made social and emotional learning programming more accessible and harnessed the intrinsic motivation of caregivers to support their children. Plus, our ongoing engagement boosted their confidence. Constraining factors were plentiful. Social distancing was difficult, as most play involves contact. Bangladesh was incredibly challenging in terms of tech and accessibility, as many families did not have devices, and those that did most often favored the male child and did not prioritize screen time towards educational pursuits. Also, the internet was an issue, especially in the Rohingya camp where Wi-Fi was not permitted. The content was localized and made available in 3 languages, English, Bangla, and Rohingya, which has no script. But the concepts were tough to grasp and required massive simplification of verbose explanations. With travel restricted, we conducted our first remote training. While it worked, it showed the importance of community building and sharing that in-person training provides. Our team and partners were spread across 7 time zones, driving meetings to very unconventional times. Plus, we had 30 days to deliver the Bangladeshi pilot, which did not give us enough time to validate the new data collection tools and systems. Nevertheless, we gathered rigorous data from our 4 assessment tools. Given these numerous hurdles, we speculated that a successful pilot in Bangladesh would lead to promising replication elsewhere. And we were correct. Since the initial test run, we have piloted Colors of Kindness in Uganda and in Greece in both refugee camps as well as public schools, all showing similar results and proving how adaptable the program is across varying contexts. It is important to mention that the impact on cognitive and academic outcomes was not tracked, but is something we aspire to in the future. Lastly, the global understanding of the importance of both teacher and learner well-being highlighted by the pandemic has exponentially increased the demand for social and emotional learning. However, the funding for such interventions has not grown at the same speed. So many valuable lessons learned. COVID forced implementers to push their creative limits and understand the core elements of adaptation and strategic pivoting mechanisms like flexibility. While it is important to move quickly with agility, you must also invest time for proper planning to mitigate team burnout. Having a continuous feedback loop that utilizes the data collected to enhance future iterations is crucial. We produce after-action reflections to produce even higher quality programming in subsequent iterations, as seen in Uganda and Greece. Greece in particular has asked us to scale the model to all primary schools nationwide this September, which in part is motivated by the symbiotic alignment to their new Skills Lab initiative, but is in large part reflective of the numerous enhancements integrated on several feedback iterations. The results on our evidence-based pilot in Greece, validated by the ESA Lab of Harvard Graduate School of Education, will be available this fall. Our biggest finding was how Colors of Kindness helps children meet the preconditions for learning. Lastly, strategic partnerships and funding for scale are key to the sustainability of any intervention. Oftentimes, funding is limited to one-off projects that do not serve the best interest of the child. Therefore, strategic partnerships and multi-year funding streams are needed for sustainable results. Ultimately, our biggest takeaway was the opportunity to reimagine learning by embracing whole child development so children can flourish no matter what their circumstances may be. Thank you, and back to you, Kate.
Thank you so much, Danielle, for that presentation. What an exciting intervention, and I can only imagine the hard work to bring it to fruition. So let's all just take a quick stretch in our seats. We have been sitting for some time, and in a webinar on this topic, we would be deeply remiss if we did not practice giving ourselves what we need to learn during this discussion. After the next presentation, we will also have a chance to reflect on what we've heard before jumping into some small groups to discuss. So next we have Vijay Iyer and Madian Kerema from STIR Education, who will share with us an intervention which provided continuous professional development to teachers and education personnel across Uganda. So I'll hand it over to you, Modern.
Thank you, Kate. Good morning, good afternoon, good evening, ladies and gentlemen. As Kate has said, my name is Modern Karema, and I'm the Uganda Country Director for STAR Education. So I want to start our presentation from the very beginning. So before the advent of COVID-19, STAR Education in Uganda was implementing a system-led or a face-to-face continuous professional development program for teachers across 78 out of the 146 districts in the country, and that would be Uganda. And then in came COVID. And so as a stopgap measure to stop the transmission of COVID-19 in high-density populations, which of course included schools, the government of Uganda through the Ministry of Education closed all schools and academic institutions in the country for the next 18 months. We are on record for having the longest school closure in the world. And so STAR, being a STEM-led program, was requested by the Ministry of Education to feed into the national COVID-19 response plan, facilitate a virtual program that would engage the teachers and head teachers to ensure continuity of teacher professional development during the lockdown, given that all the other stakeholders, all the other civil society organizations were mainly centered towards continuity of learning for learners. And so in came what we call the pivot from the existing face-to-face program to now a new virtual program. So what was that virtual program all about? So the new virtual program, which we implemented from 2020 up to December last year, included a virtual CPD program for teachers and head teachers in both primary and secondary, both public and private schools, using radio programming. And it had a number of components. The first one was having a co-design component, where the co-design team at the Ministry of Education would design content for a radio script. That radio script would then be voiced by system players, and those would be district education officers, inspectors of schools, and they would create a 45-minute airplay of that audio that would then be aired on 15 radio stations across the country. And then in that, while the audio is playing, there would be some district education officers in the studio that would be taking questions from the audience, who would then answer those questions as and when they come in from across the listenership. And the good thing that we learned from this is that these radio CPD lessons weekly were very much central in keeping the engagement of teachers. We also would, after that, send a one-pager to the district and teacher and head teacher WhatsApp pages, so that whoever has missed the radio program can comfortably read the one page on WhatsApp and know what the issues have been for that week. What were the results of that intervention? From the longitudinal study findings out of the study that has been done by an independent evaluator here in Uganda called Ichuli, we have got to learn that 77% of the surveyed stakeholders said they listened to the program. And that's important for us because even when we were starting that program, we were not sure that we would have people listen to the program. Why? Because one, we were not sure of the ownership of radio by stakeholders. Two, we were not sure that even when people had radios, they would actually listen in. So that was a very good finding for us. The second result is the fact that more than half of this education personnel who were interviewed in that evaluation study said that radio CPD programs helped them to cope with the stress of COVID and gave them hope that one day the schools would open and they would go back to their normal routines. And again, this is from the context of this being the longest school lockdown across the whole world. We also have seen the fact that after COVID, after the schools reopened, we have seen that the Ministry of Education and all its agencies have, there is data that shows that there has been an increased national understanding and appreciation of the priority of teacher well-being. When schools opened in January of this year for term one, most of the interventions that came from the ministry were more around how do we ensure the well-being of the learner, how do we ensure the well-being of the teacher. That compared to where we have been, where an inspector would go to school and their interest is how many teachers do you have desks, do you have pit latrines? Now the switch to actually the inspectors and the district education officers ensuring that they are following up on have you done trainings on well-being, Do you think the teachers are fine even when they are in school? We thought that was a very good result of the intervention. And also the understanding and increased understanding of the need for teachers to be able to not just show up physically, but also socially and motivationally in class and in school was a result of that intervention. There's also results around ICT support, the fact that connection with live radio audiences across the whole country with peer teachers and head teachers, the fact that this was the only intervention that was geared towards ensuring that you do not leave out teachers in one of the longest, actually the longest lockdown in the world. And then also the fact that there was at least something to keep teachers professionally engaged during lockdown was another very good result. What are the enabling factors? The first one, of course, is that most of the target group members had access to radio. So if they didn't, then clearly they would not be having these results. The second is the fact that most of the stakeholders had phones that could be used for coaching calls and access to the one pager that would send to them over WhatsApp. The third is the target group could tune in from their place of comfort, and this is important because during COVID, most of the teachers now started doing their own economic activities, farming and all that. So the fact that somebody could actually tune into the radio show when they're in their plantation was key in enabling the success of the intervention. The radio stations, of course, were available in all the target areas of intervention. And then lastly, the system stakeholders were available to design, right from the core design team down to having teachers and education officers sit in radio studios and engage with the audiences was great in enabling this program. What are the constraining factors? We saw about 3. The first one was lack of space, of course, for immediate practice of the learnings. And this coming from the context of this 18 months of closure meant that even when they learned about issues of emotional well-being and how to treat kids when they're how to handle learner well-being, they could not practice it. So they would learn, but they would not practice in class because the schools were closed and the classes were closed. The other one was, of course, around poor radio frequency coverage across the rural areas, the remote areas. Even when these were regional radio stations, there are some areas where clearly the frequency wouldn't reach. So some of those teachers in those areas were, of course, left out of this intervention, which was a huge challenge. And then the third was around the context that we're operating in. About half of that time was spent in campaigns for presidential and parliamentary elections. So you would book time on the radio station to do the program, and all the stakeholders know, for example, this Tuesday 3 p.m. is when we have our program, but at that very time, some politician comes and takes over the airtime that you had booked, and the stakeholders knew that you're going to air the radio program. So that also became a challenge. How did we go around this? The first one, of course, was the re-airing of those the missed sessions. The second one was having conference calls with stakeholders, right from the national down to the head teacher, so that they understand what the program was about, and then they can get back to the teachers and take them through. Learnings and future programming. The first one is, of course, around the use of tech in education. One thing that we found out was use of tech ensures equity and inclusion better than when you're doing a physical or face-to-face program. This is because we found out actually that the programs that were running on radio were being received by parents, by other teachers in districts that are not part of the 78 that we physically go to. Because it's a radio station, it can reach other districts that you do not actually operate in. So that was radio tech versus equity and inclusion. The other one was the efficiency of EdTech in program implementation. When we compared the cost of the physical or face-to-face program compared to the cost of the radio program, we found out that actually it's not even a third of the cost of the face-to-face program. So that's a learning that we are trying to see. How do we move ahead and use this tech in our programming? And then the other one would be around radio program and all EdTech programs being potentially accessible by everybody, even when you do not necessarily work in those areas. And then the last one, of course, would be around the incorporation of tech in now the physical program or the face-to-face program that we have now gone back to. With schools being open in January of this year, because of the learnings we got from the radio program or the virtual program we're running, and the fact that we found out about ownership of radios, ownership of smartphones, we have incorporated some of the learnings, for example, use of the QR codes, putting them in the handbooks, so that teachers and head teachers, as they do the training in the face-to-face program, can actually use some of those, some of that technology to implement the physical program. So we are now blending part of what we got from the virtual program to now include it in our face-to-face physical program. So those would be some of our learnings, and we hope that is some good learning that some of us can take on, and we'll be glad to get feedback on how we can work with each other to make this better, and also very importantly, to increase equity and inclusion for the left behind. Thank you very much.
Thank you, Modern. Really, really interesting work, and I think lots of interesting lessons for us to learn from your experiences. At this time, before we move into small groups, we want to do kind of a check-in with all of you and kind of ask all of you, as probably I was doing as you were listening to the presenters, thinking about what are some common themes or takeaways that you're taking from across the three interventions that were described. So for example, you could think about what were some of the features that stood out to you as kind of strengths in the interventions. What was something that you learned about taking what was initially a quick pivot or a response and thinking about how to translate that into longer term recovery programming, or anything else that kind of stood out to you as kind of a key immediate takeaway for you. And we'd like you to share your takeaways on a tool called Padlet. Now, I'm presuming some of you may have used Padlet before, but if you have not, you can access it by clicking on the link in the chat or scanning the QR code on the slide with your camera. To add a note to Padlet, what you need to do is you click on the pink plus button at the bottom of your screen. You can add a title in big, bold text, an idea in smaller text below, or even include an image if you'd like that best represents your idea. When you're finished, it's important that you hit publish. And if you feel comfortable, we encourage you to write your name and organization so we can attribute your ideas to you as needed. So what we're going to do is give you a couple minutes now to write down your responses in the Padlet. And then we'll just have a look at what people have put. We encourage you to read around a bit. If you like, you can kind of like other people's ideas by clicking on the heart icon, or comment on it by clicking on the speech bubble icon. So go ahead, take a couple minutes and put your thoughts into that Padlet, please. Okay. If you haven't had a chance to complete your thought, you can feel free to press publish on what you put in as of now. What we're going to do is now move into some breakout sessions, and we can already see some themes emerging that we're going to look at a bit more now in smaller groups. What we're going to do is we're going to be putting you into groups with a designated facilitator, and we're going to ask you to think a bit more about what you've just heard, but we also want you to now connect it into your own practice and into your own realm of work, and how maybe some of the learnings that you've heard about also resonate with your own experiences. Now we're going to have about 20 to 22 minutes in our small groups, and then we're going to return to this plenary to draw some conclusions. We're going to also, at the very end of this, so this is a bit of a carrot for those of you to stay on till the end, we're going to share with you a recently developed tool which you might be able to use in your ongoing work. Now we're going to randomly assign you to a group. If you had previously indicated that you were going to participate in a Spanish or French-speaking group, we're going to put you in that room. If you need to join one of these rooms, you can also return back to the main room and let the producer know, and she'll make sure to move you to where you need to be. So we're going to go ahead and move you into your small groups now, and we'll see you back here soon.
I think that, from the breakout rooms, some of the comments in the Padlets and some of the discussion really was around the ways that adaptiveness stems from investing in our mechanisms and processes so that we can strategically identify and leverage opportunities across the systems or the ecosystems where we work. And that can help address constraints and also to mobilize that we need to have platforms fit to context, that's incredibly important. And developing trustful partnerships and alliances also is very, very helpful and necessary. Responsiveness is another key factor, which comes from really systematically generating data and evidence around what we do and adapting our responses based on that in real time. So specifically working toward addressing the needs of those who are most affected by the given crisis and recognizing that our partners have an intrinsic motivation to be involved and to produce knowledge within these processes. And then finally, generating data and evidence around what we do and feeding it into our responses and sharing it is important so that others can also learn and hopefully not repeat our mistakes and difficulties. So we've noted that also, identifying and mobilizing non-traditional stakeholders in support responses, which includes caregivers, maybe parents, and noting their comparative strengths within that context can be important, as well as aligning with existing coordination mechanisms so that we're not reinventing the wheel, making sure that we are working across sectors, and fostering mechanisms that better identify people and populations who are disproportionately affected by the crisis, right? And then finally, prioritizing an evidence-based response. We very often have ideas, we have evidence about what works, and so putting that into practice, I think, is very important. And now in our last few minutes, I would like to turn over to Ritesh and Julie to close the webinar and share some additional insights with us.
Thanks, Kate. I think you've done a brilliant job of kind of summarizing the collective conversations that took place across the different groups. And in these last minutes, we'd like to actually share with you a couple of things that we're currently either have just completed and are now happy to share with all of you as members of the wider community, or things that we're going to ask you to provide input on as we continue some of this research and work. So I'm going to hand over to my colleague from the University of Auckland, Kayla Bover, to tell us about some of this. So Kayla, over to you.
Great, thank you, Ritesh. So first, we would like to invite you all to complete a survey. And that survey is going to help to inform our wider research on the resources that you have been using during the COVID-19 response to help us and the sector to understand what resources are being used and to what effect. And it's going to help us to identify any resource gaps that you feel there are as well. And so you can scan the QR code that's currently on your screen, and the survey will just take about 10 to 12 minutes. So it will be very helpful if you're able to let us know what resources you're searching for, what resources you have used, what you've found useful about them. And then lastly, hopefully you've gotten a chance to scan the QR code. And lastly here, we want to share with you a tool that we have developed during this research. This tool, again, you can scan the QR code to access it. It's on the EduLink site. This tool is an interactive map of approximately 200 education resources. And these resources have been developed by a wide range of stakeholders during the COVID-19 response across a variety of contexts and across a wide range of education subsectors. And this tool allows you to easily sort the resources to find those tools, policy guidance, research reports, and other types of resources that are most relevant to meet your needs, the context that you're working in, the topic that you're working on, the subsector that you're working in. And so we really welcome you to download this tool and to use it. So again, if you want to just scan the QR code, that will bring you directly to the download page. And finally, the chat box will also be providing the link for that. So now I will hand it back to my colleague, Ritesh.
Thanks, Kaylee. And that kind of brings us pretty much to the conclusion. But just to say, if you didn't manage to get the QR code, if you don't manage to get the link, we are going to be also sharing and disseminating some of this through the different networks, the learning networks that are part of ECCN. And so we want you to think of it as an invitation to continue to be engaged and active in ECCN and the other learning networks. And so lastly, we're sharing with you some QR codes at the bottom of the slide that can take you as well to the ECCN LinkedIn channels. We will be sharing some further information from this presentation, sharing the tool that that Kayla talked about, and this invitation to the survey again. So keep your eyes out in your inboxes for that. But I'd like to now conclude and really thank my colleagues and presenters who spent a lot of time and energy, not just today, but in the months and years preceding with the work that they've been doing on their interventions. And many thanks to all of you for participating in the webinar with us today. For some of you, it's quite early. For some of us, it's quite late. And the fact that all of you managed to join is a testament to your interest in this. We hope that all of you will take some of the ideas, tools, strategies to inform and continue to shape your COVID-19 recovery responses. Because as you know, we're while we can pretend that COVID-19 is a thing of the past, we know it's still very much part of our lives, and it is impacted and continues to impact education systems globally. So we wish everyone a great day. Thank you again for joining, and stay tuned for future webinars.